Understanding muscle strength and endurance tests. Today, we explore the significance and methodologies of assessing muscle strength and endurance in adults. Muscle strength and endurance are fundamental aspects of overall fitness, contributing to improved bone density, better blood glucose regulation, and enhanced capability for daily tasks. Regular testing of muscle fitness helps establish baseline levels and highlights areas for potential improvement through specific training programs. Importance of muscle fitness. Improved bone mass. Strength training enhances bone density, reducing the risk of osteoporosis and fractures as you age. Improved bone mass contributes to overall skeletal health and resilience against injury. Regular muscle fitness activities help regulate blood sugar levels, which is crucial for preventing and managing diabetes. Enhanced muscle function improves insulin sensitivity, positively affecting glucose metabolism. Increased muscle strength and endurance enable individuals to perform daily tasks more efficiently, from carrying groceries to climbing stairs. This enhanced functional ability contributes to a higher quality of life. Testing muscle fitness provides valuable insights into your current physical capabilities. It helps identify strengths and weaknesses, enabling personalized training plans to enhance performance and prevent injuries. Identifying specific areas that require improvement allows for targeted training interventions. This focus leads to better outcomes in muscle performance, endurance, and overall fitness levels. Muscle strength refers to the maximum amount of force exerted by a muscle or group of muscles during contraction, measured through various resistance tests. These tests can be static, where muscles are contracted without movement, or dynamic, involving movements against resistance, providing essential insights into muscle fitness and function. Types of strength tests. Static strength tests involve contracting muscles without any limb movement, allowing for the measurement of maximum force exerted by a muscle group. These tests are useful for assessing strength in a controlled manner. Dynamic strength tests measure the strength of muscles during movement. These tests involve pushing or pulling against resistance, providing insight into muscle performance during physical activities. Strength tests can also utilize machines or manual resistance from a therapist to gauge muscle strength effectively. This approach allows for tailored assessments based on individual capabilities and safety considerations. Measuring grip strength for health insights. Grip strength is a critical indicator of overall muscle strength and health. Using a dynamometer, this static resistance test can reveal potential health risks, such as an increased likelihood of cardiovascular diseases associated with significant reductions in grip strength. Dynamic strength testing, the bench press and leg press. Bench press for upper strength, leg press for lower strength, utilization of resistance machines. Muscle endurance reflects the capacity of a muscle or muscle group to sustain prolonged activity, whether holding contraction or performing repetitive movements against resistance. Understanding muscle endurance can help assess overall fitness, diagnose conditions, and create tailored training programs for improvement. Testing muscle endurance, push-ups and sit-ups. The maximum number of push-ups performed without rest is a fundamental test for evaluating upper body endurance. This exercise targets multiple muscle groups, including the chest, shoulders, and triceps, providing insight into overall muscle function and fitness levels. The maximum number of sit-ups performed without rest measures abdominal muscle endurance, which is critical for core strength and stability. This test can vary significantly based on age and fitness level, helping to identify areas for improvement and targeted training. Resistance exercises like the bench press and leg press can be adapted for endurance testing by determining the maximum number of repetitions that can be completed at a set weight. This approach offers a way to assess muscle endurance in a more controlled environment, providing valuable data for training adjustments. Resistance training essentials: tailored exercise selection, incremental weight increases, importance of rest days, balanced nutrition focus, guidance from fitness experts. Open chain exercises allow for greater movement freedom and are typically performed in non-weight bearing positions, beneficial for isolating specific muscles. Examples include leg extensions and bicep curls, where the moving limb is not fixed and can move against resistance freely. Closed chain exercises involve fixed positions for the hands and feet and are performed in weight-bearing positions, which promote joint stability and coordination. Movements like squats and lunges engage multiple joints and muscle groups, enhancing functional strength and stability. Muscle strength and endurance play a crucial role in maintaining overall health and fitness. Regular assessments combined with tailored resistance training programs can lead to significant improvements in muscle function, injury prevention, and quality of life. Thank you for listening.
Let's now go to main symptoms of full cold. Feeling cold. A common symptom of full cold individuals often experience a chilling sensation throughout the body, particularly in the limbs, regardless of the surrounding temperature. Cold limbs. Cold limbs are a typical indicator of full cold, manifesting as a lack of warmth in the extremities. No thirst. Individuals often have a decreased desire for beverages, particularly cold ones, and may express a desire for warm liquids to alleviate discomfort. Pale face. A pale face is a visible sign of full cold, reflecting the lack of warmth and circulation. Abdominal pain aggravated on pressure. Abdominal pain that worsens upon pressure is frequently reported, indicating internal discomfort associated with full cold. Desire to drink warm liquids. The desire to drink warm liquids highlights the body's need to counteract the cold sensations internally. Loose stools. Loose stools may occur as a result of the body's response to cold conditions affecting the digestive system. Clear, abundant urination. It can be a sign of full cold as the body's response to an imbalance. Deep, full, tight pulse. It indicates a strong presence of cold, often assessed during a physical examination. Pale tongue with thick white coating is a characteristic of full cold, revealing internal coldness and dampness. Physical indicators of cold in the body. So we have pale face, which indicates cold. Pale tongue reflects cold. White tongue coating suggests cold. Bluish purple tongue signals cold. Bluish lips indicate severe cold. Cold fingers and toes observed. Understanding the full cold manifestations. The Young lens. Full cold is fundamentally linked to an excess of yin, which leads to the contraction and obstruction of bodily functions. This imbalance manifests physically in symptoms such as pervasive coldness, pain, and various digestive issues, illustrating how yin excess disrupts the natural flow of qi, and enhances sensitivity to cold. Impact of exterior cold on internal organs. Understanding how external cold influences internal physiology is crucial for accurate diagnosis and treatment. First, stomach invasion. Cold can invade the stomach, leading to symptoms such as vomiting and epigastric pain. Next, intestinal penetration. When cold penetrates the intestines, it can result in diarrhea and abdominal pain. Uterine effects. Full cold can affect the uterus, manifesting as acute dysmenorrhea. Liver channel invasion. Cold may also invade the liver channel, causing swelling and pain in the scrotum. Thank you for your attention.
Let's now talk about spleen 21, Tapao, the great wrapping. Spleen 21, which translates to great wrapping, is a vital acupuncture point on the lateral chest wall that acts as a general connecting point with the spleen. It facilitates the movement of blood and qi, contributing to the overall harmony and health of the body systems. Anatomical location. Spleen 21 is situated on the lateral chest wall on the mid-axillary line. It is positioned 6 below the end of the anterior axillary crease, approximately midway between the axilla and the termination of the 11th rib. This precise location allows for effective acupuncture treatment. To locate spleen 21, practitioners palpate the chest area to identify the most tender spot. This tender location typically falls at either the 6th or 7th intercostal space. This method ensures that the acupuncture treatment is applied accurately and effectively. Spleen 21, known as the Great Enveloping Point, serves as a critical junction for blood connecting channels throughout the body. This point not only facilitates essential exchanges between internal and external environments, but also promotes harmony and connection, allowing the body to function with fluidity and balance. The role of spleen 21 in blood and qi movement. Understanding how spleen 21 facilitates the movement of blood and qi is crucial for holistic healing as it supports vital body functions. Spleen 21 actively moves blood within the connecting channels, ensuring a steady flow that supports overall health. The point works from the exterior to the interior, harmonizing external influences with internal functions. Spleen 21 plays a key role in alleviating stagnation of blood and qi, promoting enhanced fluidity and restoring balance. Therapeutic uses: generalized blood stagnation pain, muscular pain relief, alleviating heart oppression, promoting qi circulation, and supporting emotional balance. Indications for spleen 21 treatment. Spleen 21 is utilized for addressing various symptoms associated with blood and qi stagnation. Generalized fatigue affecting daily activities, sense of oppression, particularly in the heart area. Aches moving throughout the body due to blood stagnation. Point combinations with spleen 21. Spleen 21 plus spleen 4 connects the spleen great connecting channel to the chongmai, enhancing the flow of qi and blood throughout all three tiao, thereby improving overall treatment efficacy and promoting balance. The spleen 21 and lung 7 combination will target respiratory issues such as cough and asthma by facilitating better lung function through the connection of the spleen and lung meridians. This combination supports the respiratory system while addressing underlying stagnation. Spleen 21, known as the Great Enveloping, serves as a vital junction point, facilitating the seamless movement of blood and qi. It embodies the protective and nourishing qualities of the spleen, ensuring harmony and balance within the body. Thank you for your attention.
Let's now go to understanding kidneys and urinary bladder. Let's discuss the role of dietary factors. Exploring the essential balance of dietary factors affecting the kidney and urinary bladder health. Understanding the kidneys and the urinary bladder. The kidneys and urinary bladder play crucial roles in maintaining the body's homeostasis by regulating fluid balance, electrolytes, and waste elimination. They are essential organs for filtering blood, producing urine, and ensuring the body functions optimally. The importance of salt for kidney health. Salt nourishes the kidneys. Salt plays a crucial role in nourishing the kidneys, helping maintain their essential functions. A moderate intake is vital for the kidneys to operate effectively as it influences fluid balance and electrolyte levels. Essential for kidney health. Adequate salt intake is essential for maintaining kidney health, as it helps regulate blood pressure and fluid balance. A deficiency can lead to various health issues, underscoring salt's importance in the diet. Cravings for salty food. Many individuals with impaired kidney function experience cravings for salty foods, indicating a natural response to their body's need for more salt to support kidney health. This craving reflects the kidney's struggle to maintain balance. Achieving balance in salt intake for kidney health. Maintaining the right amount of salt in your diet is crucial for kidney function. While salt is essential for nourishment and function, excessive intake can lead to depletion, highlighting the need for balance in dietary habits. Common misconceptions about salt. Salt nourishes kidneys effectively. Too much salt depletes kidneys. Excessive salt avoidance is harmful. Salt enhances food enjoyment. Thirst should guide hydration. The role of water in kidney function. First, excess water intake can harm kidneys. Excessive water intake can lead to kidney damage as the kidneys become overwhelmed and cannot efficiently filter out the excess fluid. It's essential to recognize that moderation is key to maintaining kidney health. Thirst should guide water intake. Listening to your body's thirst signals is crucial for optimal hydration. Overdrinking water can dilute essential minerals and negatively impact kidney function. Misconceptions about daily water intake. Many people believe that they must consume a specific amount of water daily, often ignoring their body's individual hydration needs. This one-size-fits-all approach can lead to excessive water consumption and stress on the kidneys. Hyponatremia, the consequences of salt deficiency. Understanding the impact of salt deficiency on mental health and kidney function. 20%, a percentage of children affected by poor mental development due to hyponatremia. 60% of adults with cognitive impairment linked to salt deficiency. 3 liters, the average amount of excess water intake that can lead to hyponatremia. 1 in 5 or ratio of hospital admissions related to hyponatremia. Nating perspective on salt in kidneys. The Nating emphasizes the importance of salt for kidney health, stating that salt nourishes the kidneys and that a balanced intake is essential for maintaining their function. It suggests that cravings for salty foods can indicate poor kidney function and highlights the need for adequate salt consumption rather than complete avoidance. Modern understanding of salt and water balance. Contemporary physiology recognizes that while salt is indeed essential, excess intake can lead to health issues such as hypertension. Modern studies also point out that salt deficiency can arise from excessive water consumption, leading to cognitive and physical health problems, aligning with ancient insights regarding the detrimental effects of imbalance in salt and water intake. Achieving balance for optimal kidney health. Maintaining a proper balance of salt and water is crucial for kidney function and overall health. Recognizing that both excessive salt intake and excessive water consumption can harm the kidneys is essential for preventing conditions such as hyponatremia and ensuring optimal kidney performance. Thank you for your attention.
Let's talk about TCM nutrition, yellow foods that nourish the spleen. We explore the benefits of yellow foods for spleen health according to traditional Chinese medicine. Yellow foods play a vital role in TCM by providing essential nutrients that support the spleen's functions. Their rich content of vitamins A and D contributes to overall health, enhancing digestion and muscle strength. The spleen is essential for digestion as it helps transform and transport nutrients from food, ensuring the body receives necessary nourishment. It also aids in the absorption of water, which is critical for maintaining hydration and overall health. The spleen contributes to blood production by generating red blood cells and maintaining the quality of blood. A well-functioning spleen keeps energy levels stable and supports physical endurance. A healthy spleen is vital for overall immunity as it helps filter pathogens from the blood and supports the body's defenses. Proper spleen function can lead to improved resistance against illnesses. The benefits of yellow foods: nourish the spleen, enhance digestion, boost energy levels, support immune function. Yellow foods are an excellent source of essential vitamins that support health: vitamin A and vitamin D. Health effects of yellow foods. Yellow foods are rich in vitamin A, which plays a vital role in protecting the gastric mucosa, thus preventing conditions like stomach ulcers and gastritis. This protection contributes significantly to digestive health. Vitamin D found in yellow foods is essential for promoting the absorption of calcium and phosphorus, strengthening bones and muscles, and thus aiding in their toning and overall health. Incorporating yellow foods into the diet enhances overall well-being by providing essential nutrients that support energy levels, improve mood, and boost immunity. Recommended yellow foods. Pearl barley supports digestion. Oats enhance energy levels. Brown rice is nutrient-rich. Peanuts offer healthy fats. Sweet potatoes are versatile. Pumpkins provide antioxidants. Corn is high in fiber. Chives add flavor. Soybeans are protein-rich. Lemons are refreshing. Pineapples are sweet and juicy. Bananas are energy boosters. Oranges provide vitamin C. Papayas are digestive aids. Citrus fruits are refreshing. Loquats are sweet fruits. Sugarcane is a natural sweetener. Honey is a natural sweetener. Cooking methods. Steaming, boiling, and stir-frying are effective cooking methods for preparing yellow foods. Each method offers unique advantages that help maximize the nutritional benefits of these foods. These cooking methods not only preserve the essential nutrients in yellow foods, but also enhance their flavors and make them easier to digest, contributing to better health outcomes. Incorporating yellow foods for optimal health. Yellow foods are not only delicious but also packed with essential vitamins and nutrients that can greatly enhance spleen health and overall vitality. Emphasizing the inclusion of these foods in your daily diet will support digestion, boost energy, and promote a balanced body. Thank you for listening.
Let's now go to understanding dizziness and fainting. Let's discuss a focus on vertigo disorders, exploring the causes, symptoms, and treatments of dizziness and fainting with an emphasis on vertigo disorders. Dizziness and fainting are prevalent occurrences that, while often benign, can indicate more serious health issues. It is essential to recognize the causes and symptoms associated with these sensations to ensure timely medical intervention if needed. Common causes of dizziness. Common occasional unsteadiness. Occasional feelings of unsteadiness are common and typically not a cause for concern. It's a frequent experience for many individuals and often resolves without intervention. True dizziness and vertigo. True dizziness or vertigo is characterized by a spinning sensation and may arise from various causes, including certain medications and excessive alcohol consumption. Understanding these triggers is important for managing symptoms. Common isolated fainting episodes. Isolated episodes of fainting are common and usually not indicative of serious health issues. However, repeated occurrences may signal an underlying medical condition that requires further investigation. Understanding true dizziness and vertigo. True dizziness and vertigo is marked by the sensation that your surroundings are spinning or moving. This condition, not normally and may arise from various factors such as medication side effects or excessive alcohol consumption, and can indicate underlying medical issues that require attention. When to seek urgent medical attention. First is shortness of breath, persistent chest pain, loss of consciousness. Next, dizziness and medication side effects to consider. Antidepressants and dizziness. Some antidepressants, particularly those affecting serotonin levels, can lead to side effects such as dizziness and lightheadedness, especially during dosage adjustments. Anticonvulsants may cause lightheadedness. Certain anticonvulsants used to manage seizures may cause dizziness as a side effect, particularly when doses are increased or changed. Antihypertensive and dizziness. Many antihypertensive medications, which are designed to control high blood pressure, can lead to dizziness or lightheadedness as a common side effect, particularly for new users. Understanding lightheadedness in pregnancy. Lightheadedness is a frequent occurrence during pregnancy, primarily due to hormonal fluctuations that relax blood vessels and lower blood pressure. While occasional faintness is typical, not a concern, persistent episodes warrant medical attention. Overview vertigo disorders. sudden vertigo with movement, vertigo with tinnitus and hearing loss, recurrent vertigo attacks and hearing loss, one-sided hearing loss symptoms. Benign paroxysmal positional vertigo. BPPV is a common inner ear disorder characterized by brief episodes of vertigo triggered by changes in head position. It occurs when tiny calcium particles dislodge and move within the inner ear, disrupting the balance system. Although typically not serious, it can significantly impact daily activities and quality of life. Understanding labyrinthitis, symptoms, and effects. Labyrinthitis is an inner ear disorder characterized by inflammation leading to severe vertigo, ringing in the ears, and hearing loss. Symptoms can intensify with head movements, impacting daily activities and overall quality of life. Understanding the recurrent attacks of Meniere's disease. Meniere's disease is characterized by episodes of intense vertigo, which can last from a few minutes to several days. These episodes often occur alongside fluctuating hearing loss and tinnitus, and the frequency of attacks can vary, with periods of exacerbation interspersed with symptom-free intervals. Acoustic neuroma, key symptoms and health implications. Acoustic neuroma, a slow-growing tumor on the vestibulocochlear nerve, primarily presents with unilateral hearing loss, often accompanied by tinnitus and balance difficulties. As the tumor progresses, it may lead to additional symptoms such as headaches and facial numbness or weakness on the affected side, necessitating thorough medical evaluation. Key insights on dizziness and fainting. Dizziness and fainting, while often benign, can signal serious health issues. Recognizing the symptoms, potential causes, and circumstances that require urgent attention is crucial for effective management and care. Thank you for your attention.
Acupuncture for emergencies, heavy cough. Today we explore acupuncture techniques and folk remedies for heavy cough management in emergency situations. Understanding heavy cough in Chinese medicine. Heavy cough, recognized as a significant condition in Chinese medicine, is intricately connected to phlegm accumulation, which reflects deeper imbalances within the body. Identifying the type and cause of the cough is essential for effective diagnosis and treatment. Symptoms and imbalances. Heavy cough is often linked to accumulation of phlegm in the lungs, which can obstruct normal breathing and lead to discomfort. It is crucial to recognize this symptom as it may indicate deeper issues within the body systems. In traditional Chinese medicine, a heavy cough often signifies imbalances such as spleen deficiency or lung qi stagnation. Understanding these underlying conditions is vital for effective treatment. Types of cough in Chinese medicine. Phlegm damp cough is characterized by a productive cough with thick yellow or green phlegm. Patients often experience a sensation of heaviness in the chest, indicating an excess of phlegm affecting lung function. Wind heat cough manifests as dry cough accompanied by a sore throat. It is often triggered by external pathogens and may present with additional symptoms such as fever and a yellow coating on the tongue indicating heat in the body. Phlegm damp cough is a common type of cough in Chinese medicine, defined by the presence of thick yellow or green phlegm accompanied by a sensation of heaviness in the chest. This type of cough often indicates underlying imbalance, often linked to phlegm accumulation in the body. Wind heat cough is characterized by specific symptoms that arise from external pathogenic factors. This type of cough is typically dry and may be accompanied by sore throat, fever, and a yellow tongue coating, indicating heat in the body. Identifying common causes of heavy cough. Exposure to cold environments can lead to contraction of respiratory pathways, making it more difficult for the body to expel phlegm effectively. Dampness, whether from weather or indoor conditions, can increase mucus production, leading to heavy cough as the body attempts to clear the excess phlegm. Heat exposure can also provoke coughs by drying out respiratory passages, leading to irritation and subsequent coughing fits. Dietary habits, particularly consumption of excessive dairy products, can lead to increased phlegm production, aggravating cough symptoms. Greasy foods can also contribute to phlegm accumulation as they are harder to digest and can lead to digestive imbalances, resulting in respiratory issues. Environmental factors contributing to cough. Cold air exposure, damp environments increase cough. Heat exposure aggravates symptoms. Change in weather patterns and allergens in the environment. Dietary influences on cough and phlegm production. Dairy creates mucus buildup. Greasy foods increase phlegm. Processed foods are often harmful. Spicy foods can irritate. Hot beverages may soothe. Key acupuncture points for heavy cough treatment. Lung 6 is an effective point for relieving cough as it helps to clear phlegm and alleviate respiratory distress. It is particularly beneficial for coughs associated with phlegm accumulation. Lung 1 is known for its ability to support lung function and ease cough symptoms. It helps to reduce lung heat and phlegm, making it a crucial point for heavy cough treatment. Heart 1 is primarily used to address emotional components that may contribute to coughing as it helps to soothe the heart and calm the mind, promoting better respiratory function. Lung 5 is particularly effective for relieving cough and clearing phlegm, aiding in the reduction of symptoms associated with heavy coughs and respiratory issues. Therapeutic techniques for heavy cough. Acupuncture plays a crucial role in treating heavy coughs by targeting specific meridians and points, such as lung 6 and lung 1, which help clear phlegm and relieve cough symptoms. Bleeding therapy, specifically at Sifong points, is particularly effective for treating severe coughs, especially in children with whooping cough. This method helps to reduce phlegm accumulation and relieve cough symptoms. Folk remedies utilize common ingredients found in kitchens to alleviate cough symptoms. These remedies are often simple to prepare and can be effective in treating different types of coughs. Bleeding therapy on the Sifong points is a traditional Chinese medicine technique that can significantly alleviate symptoms of whooping cough in children. This method involves the gentle puncturing of specific acupuncture points on the fingertips to promote the release of excess phlegm and improve respiratory function. Folk remedies for whooping cough. Carrot juice remedy. Prepare juice from 500 grams of carrots. Add a little crystal sugar, steam the mixture, and drink it warm twice a day to alleviate whooping cough symptoms. Pear and ephedra remedy. Steam a pear with 1 gram of ephedra. Remove the ephedra after steaming and eat the pear to help relieve coughing. Pear, walnut, and rock sugar soup. Cook a soup with 150 grams of pear, 30 grams of walnut, and 30 grams of rock sugar, and consume 2 to 3 times a day for cough relief. Green onion and pear soup. Boil 7 green onions, 1 pear, and 50 grams of sugar in 300 ml of water, and drink the soup twice a day to relieve cough symptoms. Loofah seed powder. Grind dried loofah seeds into powder and consume 9 grams 3 times a day to alleviate cough symptoms. A simple yet effective remedy for whooping cough involves freshly prepared carrot juice. The sweetness from the crystal sugar enhances the flavor while supporting recovery when consumed warm, ideally twice daily for best results. Pear and ephedra remedy for whooping cough. This natural remedy combines the soothing properties of pear with the medicinal effects of ephedra to alleviate whooping cough symptoms. The steaming process enhances the pear's nutrients, making it easier to digest and more effective in relieving cough. Pear, walnut, and rock sugar soup, a traditional remedy. This soothing soup combines the benefits of pear, walnut, and rock sugar to help alleviate cough symptoms. Regular consumption can support respiratory health and reduce phlegm production. Green onion and pear soup, a natural cough remedy. This simple yet effective remedy combines the soothing properties of green onions and the nourishing benefits of pears. It helps relieve cough symptoms and can be taken twice daily for optimal results. Loofah seed remedies for cough. Baked and ground loofah seeds can be used as a natural remedy for coughs, providing relief through their soothing properties. Consuming 9 grams of loofah seed powder 3 times a day can help alleviate cough symptoms, making it a traditional choice in Chinese medicine. Banana and rock sugar remedy for cough. This folk remedy utilizes the natural sweetness of bananas and rock sugar to soothe the throat and alleviate cough symptoms. It is easy to prepare and can be consumed once or twice a day for effective relief. Loquat-based remedies for cough and phlegm. Loquats can be consumed as a soup by removing the skin and core from 20 loquats, adding 30 grams of rock sugar and cooking them in 500 ml of water. Drink this soup every day for 5 days to alleviate cough symptoms. For a hot cough, consuming 10 to 15 loquats daily can provide relief and is beneficial for overall health. Loquat root can also be used by washing 40 to 60 grams, cutting it into pieces, and boiling it in 100 ml of water to make a soup. Drink this twice a day for effective cough relief. Combining 6 grams of loquat kernel, 6 grams of orange skin, and 6 grams of licorice in 1000 ml of water to cook until reduced to 200 ml produces a medicinal soup effective for cough treatment. Pear and white lotus juice, a natural remedy for cough relief. This remedy combines the soothing properties of pear and the cooling effects of white lotus, making it effective for alleviating cough symptoms and promoting lung health. Consuming this juice 3 to 4 times a day can help improve respiratory function and reduce phlegm. Pear, white radish, and honey mixture, a natural remedy for cough relief. Combining pear, white radish, ginger juice, milk, and honey creates a soothing mixture that helps alleviate cough symptoms. This remedy can be taken 3 to 4 times daily for effective relief. Steamed pear and fritillaria remedy for cough. This remedy combines the benefits of pear and fritillaria, which is known for its soothing properties against coughs. Steaming the pear with fritillaria helps to enhance its medicinal qualities, making it an effective natural treatment for respiratory issues. The integration of acupuncture techniques such as targeting specific points like lung 6, lung 1, heart 1, and lung 5, alongside traditional folk remedies, creates a comprehensive treatment strategy. This dual approach not only addresses the physical symptoms of heavy cough, but also promotes overall well-being by tackling underlying imbalances. Thank you so much for your attention.
Understanding hyperthyroidism, liver and kidney yin deficiency with empty heat, exploring the connections between hypothyroidism and specific deficiencies of yin alongside symptoms and treatment approaches. Understanding hypothyroidism and its connections. Hypothyroidism involves an overactive thyroid gland that results in an excessive release of thyroid hormones, leading to various clinical symptoms. This presentation will delve into the relationship between hyperthyroidism and the underlying conditions of liver and kidney yin deficiency, along with empty heat, shedding light on their interconnectedness and treatment principles. Understanding liver and kidney yin deficiency. Liver yin deficiency effects. Liver yin deficiency can lead to heat and dryness within the body, which may impact emotional balance and stability, often exacerbating feelings of anxiety and restlessness. Kidney yin deficiency consequences. This results in a lack of nourishment of vital organs, leading to fatigue, weakness, and a general decline in physical health, which may contribute to hyperthyroidism symptoms. Interconnection of deficiencies. The combination of liver and kidney yin deficiencies can amplify symptoms associated with hyperthyroidism, creating a cycle of imbalance that affects both physical and emotional health. Understanding empty heat in traditional Chinese medicine. Definition of empty heat. It is characterized by a deficiency of yin in the body, leading to an excess of yang. This imbalance manifests as sensations of heat both physically and emotionally. Symptoms of empty heat. Common manifestations of empty heat include a feeling of heat, mental restlessness, and difficulty sleeping, reflecting the overall disruption of the body's harmony. Causes of empty heat. Empty heat can develop from prolonged yin deficiency, which depletes the body's ability to maintain balance and stability between yin and yang. Clinical manifestations of hyperthyroidism. Mental restlessness. Hyperthyroidism often leads to a state of mental unrest, manifesting as an inability to relax or focus, contributing to a feeling of overall anxiety. Feeling of heat in the evening. Individuals may experience a sensation of heat, particularly in the evening, which can disrupt their sleep and exacerbate other symptoms. Weight loss. Significant weight loss can occur due to increased metabolism and reduced appetite, often leaving individuals feeling weak and fatigued. Nervousness. It is common as the body's heightened metabolism and anxiety levels create a sense of unease. Fatigue accompanies hyperthyroidism as the body struggles to cope with heightened energy levels and metabolic demands. Insomnia. It is prevalent due to racing thoughts and increased body heat, making it difficult to sleep well through the night. Skin flushing and itching. It can occur due to increased blood flow and heightened sensitivity of the skin, leading to discomfort. Palpitations. They are common as the heart rate increases, which can be alarming for those experiencing this symptom. Hair loss can occur as a result of hormonal fluctuations and increased stress on the body, leading to thinning and shedding of hair. Exophthalmos. Exophthalmos, or bulging eyes, is a characteristic symptom associated with hypothyroidism and can lead to vision problems. Backache may occur due to muscle tension or stress, which can be exacerbated by the overall fatigue experienced with hyperthyroidism. Dizziness can be a symptom due to fluctuations in metabolism and blood pressure, often causing a feeling of lightheadedness. Blurred vision can occur as a result of increased pressure on the eyes, often linked with exophthalmos and other Symptoms of hyperthyroidism. Dry eyes are common as a result of exophthalmos and hormonal changes leading to discomfort and irritation. Tinnitus, or ringing in the ears, can be a distressing symptom often related to heightened sensitivity and stress levels. Night sweating can disrupt sleep and contribute to fatigue as excess heat in the body causes discomfort during the night. Key symptoms and signs. First, mental restlessness, feeling of heat in the evening, skin flushing and itching, hair loss, dizziness and blurred vision. Tongue and pulse diagnosis in hyperthyroidism. Tongue diagnosis reveals a red tongue that may be without coating or partially coated, indicating a deficiency of tongue and pulse diagnosis in hyperthyroidism. Tongue diagnosis reveals a red tongue that may be without coating or partially coated, indicating a deficiency of yin and presence of empty heat. The pulse is characterized as floating empty, reflecting a lack of nourishment and the body's imbalance due to hyperthyroidism. Understanding hyperthyroidism, liver and kidney yin with deficiency heat.